The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls podcast presented by Testicular Cancer Awareness Foundation. Today I'm joined by arguably who will probably be our fastest guest, at least in the water, Nathan Adrian. He's an Olympic 8-time medalist, 5 gold, 2 silver, and 1 bronze. Did I get that correct?
2 bronze and 1 silver. Close. Okay. It's really close though.
Okay, I'll take it. So, hey, thank you for being here.
My pleasure.
So you are also a testicular cancer survivor, which people may or may not know.
Mm-hmm. Oh yeah.
And we'll first talk about your swimming career. So you were on Team USA. You competed in the Olympics. Tell me about that.
Yeah. I mean, I was fortunate. I had a wonderful dream of a career. From a young age, I was exposed to fast swimming. I wasn't necessarily there yet myself. I wasn't some child prodigy, but I was like pretty good. And that meant I could go to nationals. And that meant that I could watch the child prodigies excel, at a super young age, and then watch the people on the national team. And that was great. That was great for me to see and to just kind of plant that seed of big dreams. And then from there, I was fortunate to be able to choose which school I got to go to. And I was looking at University of Texas, Auburn University, University of Arizona, and Cal. Ultimately Cal down here in Berkeley in the Bay Area won out. For me, it was a great combination of both academics and athletics. And yeah, I mean, I can talk about this for hours, but basically, it was just a whole lot of kind of wash, rinse, repeat. It was setting high goals, trying to achieve those goals. Honestly, usually I'd fall short by some way, shape or form, but you set your goals high enough, and then you fall short. That still means you're getting better. And that's what always brought me back to the sport. And that's what I love about it.
That's awesome, man. I mean, not many people can say they're Olympian. So you're crushing it.
Oh, thanks.
I mean, what is it like when you're making the Team USA?
Honestly, it's fun. I'll probably say this when we talk about cancer too. There's kind of this dual nature of time where it's just like, on one hand, you're just like, I have felt this, I have dreamt this, I have wanted this for so long. This is this unbelievably surreal moment. And then on the other side, it's also like, man, I've worked so dang hard for this. Like, I deserve this. You're dang right. I'm on this podium, So kind of both of those feelings happen at the same time. You kind of alternate back and forth between the two of them. I mean, certainly if there's one thing I've learned in the past couple of years is that, humans are capable of feeling more than one emotion at the same time.
Yeah. And as an Olympian, I mean, you are in tip-top shape, which I think probably, and you can explain better, I mean, when you got diagnosed with cancer, probably came as a shock.
Absolutely. My job was to be healthy, right? Like they taught the diet and exercise. That's what it takes to be healthy, right? Prevent all these diseases and this and that. And then, for me and for testicular cancer, that didn't necessarily matter. Your number is still up when it is up. And it was a really tough pill to swallow. People probably know, or they're discovering now, if they're listening to this podcast, testicular cancer is for the most part a young man's disease. And I was smack in the middle of that age. I was 30. It had been like a couple of weeks after I turned 30. And here we go. I have cancer. And that was, just hearing those words, or I think that, again, this our inside group here, the vascularized mass, right? Like that rings a bell for all of us. And it's kind of where your heart drops a little bit and you're like, it's a tumor. I got to deal with this.
Where were you in the point of your kind of training when you first were diagnosed?
Man, I was training really well. It was the year before the Olympics, or when we all thought 2020 was going to be the Olympics, of course. And yeah, I was really diving back in, like no pun intended, really diving back in head first. Cause after 2016, 4 years is a really long time to be 100% engaged into swimming, into recovery, into, 24/7 thinking about my actions getting reflected in my performance, right? So I sort of engaged in segments. That first year, it was like, I'm going to show up to practice and I'm going to try hard at practice. That second year, it was kind of like, I'm going to show up to practice and I'm going to focus on my recovery a little bit. That third year, that's when it's like, all right, I'm going to show up to practice. I'm going to focus on my recovery. I'm going to work on my, on my diet and some of those other small things that really start to add up and start to matter. And it was starting to show in my training. I was starting to go real fast. I was starting to beat people, that had started to, their times were creeping up on mine because I was getting lazy. And I was getting back on track to where I wanted to be. And boom, there you go. I go to a winter nationals and I tell myself, hey, I noticed something right before that winter nationals, like a little like swelling and hardness. And I was like, all right, well, like, if this is still an issue by the time I get back home, like I'm going to the doctor. And I won the meet. I was swimming pretty fast. I was pretty excited about my times, but I come back and had to go to the doctor. So that was that.
Yeah. I mean, I can't imagine the pressure that you must have felt. I mean, cause I read something about, there was a former Olympian swimmer that you had known that went through testicular cancer.
Yeah. Eric Shanto. So he was on the 2008 Olympic team with me. And his story is interesting too, because he got diagnosed pretty early on and pushed surgery out for probably about 6 weeks. Cause I'm pretty sure his diagnosis came between Olympic trials and the Olympics. So, I mean, what a tough decision that he had to make there. And yeah, having his guidance was really, really, really helpful. I mean, he had been connected to, Dr. Einhorn, who obviously, as most of us know, discovered the platinum-based chemotherapy. He had talked to, his doctors at USC. I was fortunate that, we have a teaching hospital out here in UCSF and a guy who's really good with the Da Vinci robot. So I did feel good about that. And that's one of the things that I advocate for the most is that, hey, like you got to reach out to as many people that will take your phone call, that will respond to your email, that will, just be a listening ear. And if someone doesn't respond or doesn't, initially reciprocate your communication, go find a different avenue. Even for me, I mean, it was really, really hard to get on that UCSF schedule. Like I called the scheduler probably every day. At the time, I probably knew what his working hours were. I don't anymore off the top of my head. But yeah, it was a matter of leaving a million different voicemails, asking my doctor, my primary care doc, saying, hey, do you know anybody over there? Can you find a way to get a hold of them? And that's what it takes, right? Like, again, it's like, you want to get once you get diagnosed, again, this is kind of our universal experience. It's like, hurry up and wait. You get diagnosed or you go and you're like, okay, your primary care doc is usually, you have a pretty good relationship with them. Mm-hmm. They can maybe call in, get the ultrasound a little quicker, cause it's a little bit urgent. Maybe you'll go there first thing in the morning type of thing. But after that, it's like, oh, okay, now you got to get on a urologist schedule. And you have no idea how backed up they might be right now, especially with everything going on. And then surgery. So you get on a urologist schedule and maybe you get on on a Wednesday, but then their surgery day is the next Tuesday. And it's like, okay, I just took a week to get on the schedule. And then I have, to wait another week for the first surgery. And then you have another week to wait for pathology. And, my pathology came over the holidays. And that just meant it was actually 2 weeks of just excruciating waiting time. And yeah, so you kind of got to be that person. Like, don't be bashful. To understand that this is your health. You can afford to be a little bit annoying, for a surgery scheduler.
And I think, testicular cancer is still kind of not talked about, a little taboo. Being on Team USA, I mean, you had the former swimmer that you knew, Scott Hamilton, Lance Armstrong. Did you talk to those guys at all too, and kind of pick their brains?
Yeah, actually, totally. Lance, he reached out to me. He shot me a text. I think I ran across Scott at a event, but we didn't have time to go in depth really about our experiences. And then obviously, Eric, and to be honest, I mean, even in the swimming world, I mean, to your point, even well-known people in the swimming world reached out to me and like, hey, listen, like most people don't know this, but like me too.
Wow.
And that happened over and over. And even in the last like 4 or 5 months, it's like family friends or, friends of friends. And it's just, they reach out just kind of wanting to talk to me about my experience. And, obviously everyone's is different, but if they happen to have 100% embryonal tumor and live in the Bay Area, I can certainly talk them through what I went through, but it's just so helpful to have people that actually went through it. And so many people are well-meaning, but until you kind of are the one sitting in that seat, hearing those words, it's just helpful to talk to people who went through it.
Yeah, agreed. Let's jump back to when you first noticed something was wrong. I mean, you said it was a little hard and swelling. Were you checking regularly for,
I wish I could tell you I was, I wish I could tell you I was, because I do feel like I'm a pretty health conscious guy, but honestly, I wasn't. And for me, it was, I think I was coming down from like a step ladder and just kind of brushed across, my testicles, and it just like hurt more than it should have given that level of contact. Right.
Yeah.
We all kind of know what to expect if you hit yourself. And this was more than that. And it lasted more than that. And then I did a self check, and then I kind of compared. I was like, whoa, this guy's a little harder. He's a little bigger. Like what's going on here? I'm going to kind of watch it. And then, like I said, I went to the meet, and the pain went away, of course. And swelling and hardness didn't.
So you talked a little bit about like the waiting a week to get into the urologist and everything. Do you remember your exact timeline of events from when you noticed it to when you began treatment?
Oh, geez. I don't, I mean, I know roughly it was right about a week, before when I first noticed it to getting into my primary care doc. I'm pretty sure that we got the ultrasound. I talked to my doc early in the week. We got the ultrasound the next day. He called me when they read the ultrasound, and then the next week I was on the urologist schedule, but that particular urologist had retired from surgery. So then I had to get on another urologist schedule, do a consult, and then do surgery. So I can't remember.
That's so good.
Yeah. From that first primary care doc, it was at least 2 weeks before I was doing surgery though.
Talk more about your treatment. I know you had an orchiectomy.
Mm-hmm. Yep. Yeah. So orchiectomy. And then, like I said, that pathology went to the lab, right during the holidays. So that's a tough time. After that came back, that was when I did a consult with my original urologist, who was at one of the big hospitals around here. And he was like, hey, listen, like, based off of, it was, embryonal, and it had with LVI. So just kind of given those two. Oh, and I think on my CT scan, one of my lymph nodes was really borderline. It would depending on the radiologist, they would have said, flagged it, or another radiologist could have just let it go. Mm-hmm. So based off of all of that, they said, hey, of course you can go on active surveillance if you'd like, but this is probably something you should talk through, whether you do surveillance, adjuvant chemo, or continue down the surgery route. And they knew that the Da Vinci robot was just across the bay. I live in Oakland, but just about across the bay in San Francisco. And we have a pretty good surgeon, running it, who had achieved some pretty good results with it. Why don't you go talk to him? And that's when we hounded his scheduler over and over, got in for a consult, did the consult with the oncologist, and we just decided that, hey, all things considered, we felt like the best thing to do was do a laparoscopic RPLND. And that's what we did. So I have 4 little incisions about, centimeter and a half long, to pretty small. And I think we got rid of 35 lymph nodes or so.
Wow.
It turns out that it was the right decision, because I think either 2 or 3 of them had cancer cells in them. Obviously that one that was kind of a little bigger, that one definitely did. And then after that, because I only had like 3, and that one that was enlarged wasn't big enough to trigger a full-blown chemo, my options were then active surveillance, or I think it was up to 2 rounds, or maybe I think it was 2 rounds of what was called, I don't know if it was called adjuvant chemo at that point, but it was like, hey, active surveillance, you got a pretty, I think they gave me like a 20%. I don't know what these numbers are necessarily based on. But it was a lot higher than we wanted it to be. Yeah. Right. You go do an RPLND and you're thinking your chance of recurrence is going down to, 5 at the high level, and hopefully down to like 1%. But they were saying, hey, this is probably around 20%. I was like, oh, dang it. Yeah. And that's when, the Olympics, they were coming around the corner, right? Because it would have been a year and a half out at that point. Going 2 rounds of, I think it was EP. I wish I could remember exactly what it was, but that would have knocked me out, and it would have taken a long time to recover from that in the water. So I just decided to do the active surveillance thing. Unfortunately, knock on wood, that was over 2 years ago. So I'm done with active surveillance now.
Awesome. Congratulations.
Yeah. Thank you. I appreciate it.
And I think I read that you banked sperm, right?
I did. Yes.
And you have a daughter. Did you conceive naturally, or did you use the?
We did.
Okay.
We did conceive naturally. But yeah, no, that should be a top of mind for anybody. Certainly. It's pretty quick and easy, and they do make time for people, like us, who have to do it for a medical reason. So I certainly encourage that. That was one of the first things you think of.
Yeah. In survivorship, and obviously you have this large platform. What is your role now? Do you feel you're obviously on this podcast, spreading awareness when you can. What does that look like for you?
Yeah. It is kind of just here, there, and everywhere. And it comes in waves, really. I'll go a month and forget that I had cancer. And then the next month it'll be like, podcast here, and let's go do this event here. And then, people are reaching out of the woodwork here and there because, a family member got diagnosed and they just want to talk through things. And then it'll go another 2 or 3 months of really quiet. And then it'll all of a sudden kind of come up again. So it's kind of the waves that you're riding. And I think we have a couple charity events, coming up, a couple swims. It's not, specific to testicular cancer research, but just cancer research in general. Always happy to lend a hand or hop in a pool, if the timing allows to raise some money.
That's awesome. You always have an open invitation to Testicular Cancer Awareness Foundation events if you want to come.
All right.
We do virtual stuff, and with COVID, we haven't done any in-person conferences, but that's
I would love to. It'd be great once we can, safely. I'm vaccinated, but I have a young one at home, and still trying to be as careful as we can these days.
Yeah. Do you want to shout out any of your doctors in the Bay Area who did the laparoscopic surgery, which I do want to talk more about after you
Yeah,
give a
yeah,
shout
absolutely. Dr. Mang and Dr. Agarwal. So Dr. Agarwal, he was on I think he's on the testicular, like the tumor board. So that was really helpful to talk with him. And Dr. Ming, just, the online reviews speak for themselves, but I'm just another one, shouting from my soapbox, like, thank you, thank you, thank you. I mean, just the amount of time that he's a busy guy. I'm pretty sure he operates like 5 days a week, or maybe 4.5 days a week. Wow. He's in high demand just because he's so good. And even still, when he is doing, seeing you in the office, it's always relaxed. You're sitting down. He's taking his time and he's asking you, like, do you have any more questions? And he's waiting for you to respond to it. Not just like, hey, do you have any more questions? Okay, thanks, bye.
Yeah, that's awesome.
And so that was just so helpful. I'm really, really grateful for that. But I mean, definitely shout out to them. Sweet. And Dr. Huey, our primary care doc, who can forget, he set those wheels in motion. He primed me for what it could be. I'm very fortunate for the care that I had.
Awesome. Let's talk more about the laparoscopic RPLND, because you're the first one I've talked to that has had that. So, I mean, was there an option to do like kind of the whole open stomach, or it was straight to the laparoscopic?
It was. So I think the treatment tree, or whatever they call it, would have you look at surveillance, adjuvant chemo, or RPLND open, RPLND laparoscopic. So I guess there's 4 options there. And the open one was an option, but it wasn't one that, we were really prepared to explore given my circumstances. Mm-hmm. I think the jury is still out whether or not, laparoscopic versus open, is more efficacious. But in my particular case, it was like, let's try to exhaust all low impact surgical options possible. And then go do, the kind of chemical treatments, if necessary. So I felt fortunate that we had one near me.
What was the recovery like for that? And obviously there's a disclaimer that you are like in peak performance condition, but
yes. Yeah. No, absolutely. That's definitely a disclaimer. And even the doctors are saying, hey, like, I wasn't like Wolverine out there or anything, but I stayed one night in the hospital, of course, the worst night of sleep ever, because they just wake you up every hour. And the next day, so I think typically they say, or at UCSF, the patients stay 2 nights in the hospital, but Dr. Meng was kind of like, hey, you're in pretty good shape. If you look good after that first night, and you're scooting around and feeling all right, and all your, the vitals or whatever look good, like, we can send you home. And I was like, yes, right. It just gave me that goal to work towards, force myself to drink water when I wasn't thirsty, all that kind of stuff. The next day I basically just I think first thing that when in the morning rounds, I was just like, okay, hey, like, Dr. Meng said, like, I could maybe go home today.
Yeah.
What do you guys think? And they're like, oh, like looking at the chart, they're like, usually we have people in for 2 days. So let me go check on that. I was like, okay, cool. But he did say today, just so you know. I mean, that first day I tried to walk. But I mean, I definitely, with my little IV bag and stuff and my wife right there, and I made about 10 steps until I kind of blacked out a little bit. I had to get a chair and sit down. No shame in that, right? I mean, I think that's a universal experience probably for most of us. But man, I had to try. And then it was like, okay, fine. I made 10 steps, baby. Let's go. I'm going to go rest up. I'm going to take a nap, but I'm going to take 20 next time. And that's kind of how my recovery went. And, it was, in terms of, I didn't have, like I said, I had 4 little baby incisions like that. I was very bloated, very distended. My entire left abs, like all of them, just like wouldn't work. They were completely turned off for a long time. And I'm actually still dealing with stuff like to this day, right? Again, like we all know, you get cut through your abdominal wall at this point, it's 5 different times. Like there's just going to be a lot of weird coordination issues you have with your core. And I don't know if anybody else has this, but my left foot doesn't sweat. It's super weird. Wow. Yeah, they said, I mean, the doctor friends that I've said, they just said we probably just kind of, touched or affected a autonomic, nerve run down the leg. And yeah, my left foot's complete, like super dry. Like if I'm on hardwood, I can like run and slide with it.
Wow.
Yeah. Super weird. Fun fact about me, I guess. Yeah. So, but it was, I mean, I was home, day 2 and moving around fine. I climbed up the one set of stairs from the car to get into the house. But getting out of bed was a chore. Certainly, I'd say it was a lot like the orchiectomy, really, in terms of the recovery from that.
Yeah, that's great. It's not that bad. Relative.
Of course. Yeah.
Yeah. So, I mean, how long was it until you got back in the pool and
14 days.
Oh, wow.
They were really, really careful, they just want to make sure, again, just because we were cutting all the way to like, into my body, that everything was just 100% sealed. The worst thing you could, getting in at day 10 versus day 14, like has very, very marginal benefits in terms of like physiology and performance. But if we got an infection or something, that would just set you back months. So that was really, we were really, really careful about that. But I mean, I was doing rehab, probably in day 3 or day 4. And, it was, doing shoulder exercises, getting cupping stuff done on my upper body, that kind of stuff. It was helpful, certainly, to keep my shoulders healthy, all that good stuff. But really, I think more than anything, it was emotionally what I needed at the time. For me, there's just nothing worse for my mental health than to sit alone in the dark. This way I was going into Cal. I was at that training room. I was seeing the football team do their thing. I was seeing, lacrosse team do their thing. And just in the rehab room with a bunch of people with sports injuries, what I'm used to. And that was really, 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 those 1 or 2 hours a day was really important for me emotionally.
Let's talk about mental, because as we know with the Tokyo, I mean, obviously it's different with Simone Biles, but you guys have like this really intense, like competitive mindset. So did that at all, you think, fuel some of your recovery?
I don't think it necessarily fueled my recovery, but that mindset and how I approach the sport certainly, helped me approach my treatment. In so many ways, swimming and sports in general, there's so much you can't control, right? And it's just like such a hard lesson to really learn. Like you can hear it over and over, but to actually learn it, understand it, appreciate it, and then kind of execute, plans based off of that knowledge is something different. So that was really important for me, right? It's like, listen, I know these facts about other people in my situation at a population level, right? And from those, statistics and probabilities, I can make my decision. And even if it was a wrong decision, given all the information, it was the right thing for me. Mm-hmm. And that was something that I needed basically so I could sleep, right? Because if you let your head spin about that stuff, oh my gosh, I had a little backache today. Maybe it spread to my back and grew really fast, right? Or something like that. Or I coughed once today. It's in my lungs. Oh my gosh, I definitely need to do adjuvant chemo or something, right? Like those are the thoughts that I think we probably all had.
Yeah.
And I had to do my best to say no, like, listen to your doctors, do your own research, and then talk to, other people who are knowledgeable, and then make the best decision based off of that information. And if you do that, then you can sleep well at night, even if it was the wrong decision. Like, even if I did have a real recurrence, a year after my laparoscopic RPLND, obviously I would have been sad, of course. But it's not like I'd be like, oh, if I could have gone back, I would have known it. I needed to know it, or something like that. Like, I didn't. And that's something that I had to be really comfortable with. And sports teaches you that, because so many times you are competing against other people that you can't control. And in swimming, you can't control what they're doing. Can't control how well their season is going. All of that, even, team sports too, they might just have a better team, even though you're the best player out in the field, but dang, you can still try hard. You can still do your best.
Yeah, that's great. That's great bit of information you just gave. What does the future look like for you? Are you looking to Paris? Are you looking I know you own this swimming club that
Yeah, I'm at the pool right now. We're getting ready for our summer sessions. Around here, everybody starts getting their summer schedules lined up in January, which is crazy. But I'm in shape right now. I mean, I could easily hop back in and, 3 or 4 weeks be at a good place, but I wouldn't call what I'm doing like training to compete on the world stage. Yeah. I haven't gotten that itch quite yet, but just for, again, like my own mental health and just for myself, I just like to, lift some weights and swim every day, just to be healthy. And, again, it's kind of one of those things, man. If I like I did, of course, I wanted to be there in Tokyo. Unfortunately, I missed it. But if I start seeing world championships and other meets, and I'm like, man, I want to be there, I might hop back in. We'll see.
Well, best of luck if you do, and if not, incredible what you've done.
Thank you.
Do you have any advice for anybody who might be staring down the gun of testicular cancer really quick? This thing's telling me we're going to run out of time here in 4 minutes and 20 seconds. So.
Oh yeah, shoot. Yeah, no. Hey, I think like talk it out. Don't keep it in. Whether it be, reaching out to somebody you might know. Just you can reach out to me on my Instagram if you want. I do my best. I'm not the most responsive person ever, but certainly if there's a testicular cancer one in there, I do my best to try to respond and get back to him as soon as possible. It's Nathan G. Adrian is that Instagram handle. But yeah, that certainly made me feel better as I talk to people going through it. I can't recommend that enough.
Cool. Well, hey, thank you again so much for taking the time to talk, and I look forward to seeing what the future holds for you.
Yeah, thank you. Appreciate it.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.